Hello and welcome to this episode of DMC's Medical Matters. Today we are talking about minimally invasive heart valve procedures. And joining us today is Dr. Kaushik Mandal, who is a cardiothoracic surgeon and the medical director of cardiovascular services at DMC Sinai-Grace Hospital. Welcome.
Thank you, Cheryl.
Well, let's start by talking about what is heart valve disease and what are some of the symptoms that people should be aware of?
Thank you for that question, Cheryl. So we have 4 valves in our heart. These valves can either become too tight or too leaky, so they're not performing the function of a valve, just like a conventional valve in a plumber's valve. Now, and these could go wrong because either somebody's born with an abnormal valve, there's been infection-related damage, there's been a trauma-related damage, patients have got blockages in the heart arteries, they've got heart attacks, hence the valves are getting secondarily damaged, and there's a knock-on effect on the heart getting stretched out. So this is how the valve disease causes heart problems. Warning signs of heart valve disease may include shortness of breath, particularly when active, swelling in your ankles or feet, chest pain or tightness, irregular heartbeat, and or easy fatigue. So if these are happening, you have a family history of heart trouble, you have a history of any of the medical conditions that I just indicated, it's time for you to at least have an appointment with your primary care doctor.
And how is heart valve disease diagnosed?
So the first most important thing is the patient connecting the dots that these symptoms could be related to their heart valve issues. Next thing would be making an appointment with your primary care doctor, or you already have an established relationship with a cardiologist. Make an appointment. They're going to take a detailed history, do a clinical examination, listen to your heart for signs of leaky or narrowed heart valves, and then order an echocardiogram, which is a special ultrasound of your heart. And that's how generally the ball gets rolling.
Now, you specialize in minimally invasive valve surgery. Can you tell us how that differs from traditional surgery?
Thank you. The conventional open heart procedures mostly involve splitting of the breastbone right through the center through about a 10 centimeter cut. And the access is great, it's very safe. However, because it's a bone cutting incision, despite carrying out a very effective repair surgery for the valvular problem, recovery is slowed down quite a bit. Patients are under restrictions of not being able to lift weights, not being able to drive for 8 to 12 weeks after surgery. Return to work is affected, pain becomes an issue. So all these issues became the primary impetus for us surgeons to devise ways of treating the condition without exposing the patient to these side effects. So minimally invasive surgical approaches involve advanced technique and instruments, thoracoscopic instruments or robot, in which we do not cut the breastbone. We work between the ribs through small keyhole incisions. Potential benefits of minimally invasive heart valve surgery include a smaller incision, less noticeable scar, significantly less pain, a shorter time in the hospital, quicker return to normal activities including work.
Can every patient benefit from minimally invasive surgery?
Most of the patients will. However, it's a very nuanced decision-making process because safety is paramount. At no point do I want to compromise safety for keeping my incisions small. And there are situations where bigger incisions make the surgery safer. We want to do the same surgery, excellent durable outcome, but no unwanted complications to have a safe, smooth recovery. And the DMC Heart team, with a team of experts with varying level of expertise in imaging and clinical decision making, allow me and my team at DMC Heart Hospital to make that decision, to have an open discussion which patient is best served by a minimally invasive procedure.
Thank you. This has been very informative. And if you would like to learn more about cardiovascular services here at the Detroit Medical Center or more about minimally invasive heart procedures, please visit dmc.org/healthyheart.